All right. So as I mentioned earlier this morning, one of the things that our group wants to try to focus on each year when we have these workshops is focus on a particular special population. The Bay Area is full of with so much diversity, but it's really important for us to be able to appreciate the nuances with working with different populations so that we know how to best work with our patients and help move them forward. So to start off with the series this year, we have Dr. Flores who's going to be speaking to us about working with Latino population. So Dr. Flores is a clinical psychologist who specializes in health, injury, rehabilitation, and the management of chronic pain. She was originally trained in Mexico, where she studied clinical and educational psychology, as well as training in alternative healing therapies, Latino, cultural, spiritual, and religious healing practices, yoga and qigong, and movement and expression therapies. She has a doctorate in clinical health psychology from California School of Professional Psychology and completed a doctoral internship at the Santa Clara Valley Medical Center with rotations in the traumatic brain injury unit, spinal cord injury unit, and the burn unit. And she also led a MS support group. She's worked in functional restoration programs in the San Francisco Bay Area since 2007 and is currently the Director of Latino Rehabilitation Services for the East Bay Functional Restoration Program at IPM Medical Group. She's involved in research in the Latino community, has published works on Latinos in pain. So I welcome Dr. Flores.
Thank you, Ronnie. Good afternoon, everyone. I hope the lunch sleepiness has worn off. So I want to talk today about working with Latinos, but one of my primary disclaimers here is that Latinos are so diverse, and although that I don't want to make generalizations, I will be focusing on specific groups, specifically Mexican Americans in California, since that's the highest percentage here. But I do want to give you a little bit of background on just Latinos in general and some issues that may affect your work with Latinos. So my primary goals for today are to help you understand the key issues that affect Latino health in the United States, to give you an overview of health beliefs and pain expression among Latinos, and look at specific topics for pain management. I have a couple of case studies I want to share with you guys, and then I'll end with some treatment considerations that you may be able to use in your practice. So Latinos in the United States, by the way, the handout that you have is actually more of an outline, and you'll have more specifics here. If you do want the full presentation, I can email that to you. I'll have my email at the end. So Latinos, or Hispanics, they kind of are intertwined here, represent a large group of diverse nations and belief systems from Mexico, Puerto Rico, Cuba, El Salvador, Colombia, Dominican Republic, Nicaragua, and other Latin American countries. There are over 35 Latin American countries, so when we look at Latinos, we're looking at least 35 different countries and belief systems. So to kind of lump them into one is a little bit of a disservice, but that's where we're at right now, and I'd like to give you an overview. Latinos are the fastest growing minority group in the United States. And in 2010, there were over 50 million Latinos, and they are the most underserved population in the United States. Mexicans account for 63% of Latino immigrants, and 84% of these live in Arizona, California, Colorado, New Mexico, and Texas. California seems to be a magnet for immigrant groups, mostly because of the rich employment base and the ethnic groups that do tend to group together in different areas. There's public infrastructure to assist with acculturation, including ESL classes. You may often see in certain neighborhoods, there'll be an entire neighborhood of Latinos from a specific area in Latin America. This became evident to me at one point when I was actually studying in Mexico, and there was a festival in a small town in Mexico, and probably 90% of the people that came to that festival were living in San Jose. So I thought, oh, well, now we're transplanting ourselves somewhere else. But this is part of why California is so full of Latinos. 43% of hate crimes in California are directed towards Latinos, towards Hispanics. This comes from the FBI, and I'll talk a little bit about discrimination and marginalization amongst Latinos. So some historical considerations. Every Latin country has their own historical considerations to look at. We can't, again, lump them into one. The ones that I will be going over here are specifically to the United States, but it is important when you're working with Latino patients to get an idea of what their country of origin's history is. For example, if there is currently war going on, if there is, as there is right now in Mexico, there's a lot going on with the cartels and crime and all of these things. So that's something that adds to their pain narrative. So briefly, in 1821, much of the Southwest was under Spanish control for 3 centuries until Mexican independence. This is looking back, and when I kind of looked at the history in the United States, we don't usually get exposure to this history. I learned a lot of this living in Mexico. And there was, California was considered kind of New Mexico, and there was a group of quite a significant population of what they called Californianos. So they were people that were Californian. They were part of the Mexican Republic, but they had kind of started to separate themselves. And most of them were actually very wealthy landowners. This is around the time that also the missions started, popping up. And it's very different, and the clarification here is that, for a lot of Mexicans, they actually came from educated and wealthy backgrounds, the ones that were originally here. And the indigenous culture is something that was a little different and separate, and sometimes we confuse the two and say, well, it's Mexican indigenous, and that's not the case. They were actually already here in California and had established, land and property, and they themselves, had, believe it or not, indigenous slaves, and were very, very wealthy. In 1848, Mexico lost California, Arizona, New Mexico, Texas, Utah, Nevada, and parts of Colorado, Wyoming, Oklahoma, and Kansas. This is the Treaty of Guadalupe Hidalgo, and over 80,000 Mexicans were displaced in this treaty. So initially, the U.S. government agreed to allow them to stay in these states before they were these states. And what happened was that they signed the treaty. Mexicans signed the treaty agreeing to this, saying, okay, we'll give you the rights and privileges, and we'll go ahead and let you stay and keep your land. But the exact opposite happened. So all of their land was taken, all of their property was destroyed or taken, and they were sent back to their homeland, Mexico, when they actually had been in California and these states for generations. This was followed by negative sentiment towards Mexicans and fueled by ethnic and racial divisions. There was quite a bit of propaganda that was out, posters and messages that were targeted against Mexicans, so calling them certain names and kind of marginalizing them to get American sentiment to have a negative attitude towards Mexicans. So just to give you a little bit of an idea of what this looked like, you see that the red area down here is Mexican territory. Back then, the U.S. territory was over there to the right, and then the part that was lost is this area that was New Mexico, and that was 1848. All of that was lost to the United States. In 1939 to 1945, this is World War II, more than 300,000 Mexican Americans served in the U.S. Armed Forces. But once they returned, they were denied services. And the primary reason was that they were considered illegal immigrants, and they were thought that they needed to go back to their home country, even though they had just served in the war. 1962, this is the United Farm Workers Association, Cesar Chavez, very well known. Currently, this is active in 10 states. Prior to 1970, this is a very interesting piece of information, all Latinos were categorized as white on the census. However, they did not enjoy any of the same privileges. They were not given the same status, so they had to check the white box, but they didn't have any of the white privileges. 1986, Immigration Reform and Control Act. This is something that happened that allowed residents that were here prior to 1982 to remain in the United States. This has changed a little bit, but it was some kind of a move towards correcting some of the issues. In 2005, there was a bill passed, H.R. 4437. This was the Border Protection and Anti-Terrorism and Illegal Immigration Control Act. What this bill allowed to happen was that when an immigrant came here, quote-unquote illegally, he was and classified as undocumented, the penalty was raised to a felony. So then there's quite a few Mexican immigrants who are currently in the prison system because of this, because they're considered felons. 2001 started the DREAM Act, and currently in the 2012, the Obama administration, they agreed to stop deporting young illegal aliens, and there's certain criteria that they had to match. So what was happening is that you had families who were settled here in California or in the United States, and their children, this is specifically children who were brought to the United States at a very young age, or as babies or as children, and went to school here, were completely part of American society, and then once their immigration status became known, the parents were usually deported. Now some of the children were allowed to stay here, But you can imagine what happens when you tear a family apart. These children are here, they've already have everything established, their parents are sent back to Mexico, and in many cases, they don't have any ties in Mexico left because they've been here for 30, 40, 50 years. So, believe it or not a lot has changed. Back then, this is one of the propagandas that you see. We serve whites only, no Spanish or Mexicans. And this is a more recent billboard that was found. Stop the invasion, secure our borders. This is targeting immigrants. So now I want to talk a little bit about occupational considerations. Latinos are largely concentrated in blue-collar services. Restaurant workers, janitors, truck drivers, service industry, agriculture, and unfortunately there tends to be a fear of being deported. So there are some jobs where the employers can actually use that against them, and I've had quite a few patients that will either try to keep working with certain injuries because they don't want their employer to find out that they're immigrants, and I've actually have had a significant number of patients who have blatantly told me that their employer has threatened to deport them if they either report an injury or don't come to work and work, 15 to 20 hours and then do another extra shift on top of that. Most of these low-tier jobs carry greater risk for job-related injuries. As you can imagine, physically demanding labor, they're being exposed to certain chemicals or being exposed to certain things that are just very, very risky and can lead to long-term disease. They can lead to long-term injuries, and that's not something that's usually covered by health insurance. Work-related accidents are generally underreported among Latinos, and again, part of it is the immigration status. The other part is being threatened, and then the other part is, the level of education or preparation that they have for another type of work is fairly limited. So for them to stop a good paying job for them would create significant financial crisis for the family. I'll be sprinkling a couple of quotes in here. I did some research with Latinas, with Mexican American women in chronic pain. One of the studies I have published is specifically with treatment with Mexican American women. And I pulled some of those quotes out just to give you a better idea of what I have heard in terms of their experiences. So one of the quotes is, "I'm going to work until my body gives out." So they're willing to work. You have pain, you have injury, doesn't matter, you suck it up, you get back there to work. Mexicans tend to face a disproportionate amount of exposure to work-related hazards, as I was saying, and often the dangers are unknown. This is part of what fueled the United Farm Workers movement, is the exposure to the pesticides, and a lot of people were suffering from long-term illnesses and effects from that, and having the unionization of that helped to decrease that. Now, it still goes on. There's other industries, and I hear it from my patients as well, working with toxic materials, working with different things, and they either don't know or they don't realize that some of their symptoms are related to, working with asbestos and not having protective equipment, or, being exposed to certain chemicals and not really being told. And again, they also have the lowest rate of health insurance. So there is a perpetual pattern of Mexican labor in the United States. We want that cheap labor. We'll open the border, and there's been a few different occasions in the most recent history where the government has allowed those borders to open up to allow that cheap labor to come in. But then again, once that job is done, then it's time to go home. I don't know if you can see that too clear. It's a little comic that I found. It says, "Hey, you think you could hurry it up a bit? We're trying to keep the illegal aliens out, or keep out the illegal aliens." And the workers say, "Sí, señor."